Every minute matters when it comes to your brain. One moment you can be walking, talking, and enjoying your day, and the next, a blood vessel in your brain can become blocked, cutting off oxygen your brain cells desperately need. But many people over 60 do not know this. A major stroke often does not happen completely without warning. Your body may send signals days, hours, or minutes before a serious stroke occurs. The problem is most people ignore these signals because they disappear quickly and they tell themselves, "It was probably nothing," or "I was just tired." Today, we will cover the warning signs everyone over 60 should know, what happens inside the brain during a stroke, and steps that may reduce your risk. These signs do not mean someone definitely has a stroke, but sudden neurological changes should always be evaluated by a medical professional. When people hear stroke, they often imagine sudden collapse. In reality, a stroke is usually the result of a process developing silently inside blood vessels for years. A stroke happens when part of the brain does not receive enough blood and oxygen. There are two main types. Ischemic stroke occurs when a clot or plaque blocks an artery supplying the brain. Hemorrhagic stroke happens when a weakened blood vessel breaks and bleeds into or around the brain. Both are medical emergencies, and ischemic stroke is the most common. Your brain is about 2% of your body weight but requires a huge amount of energy. It controls movement, speech, memory, vision, balance, and thinking. It depends on a continuous supply of oxygen and nutrients. When that supply is interrupted, the affected area struggles, so doctors treat stroke as a race against time. Faster medical attention increases the chance of limiting brain damage and improving recovery. Many strokes are linked to changes inside arteries over many years. High blood pressure, smoking, high blood sugar, high cholesterol, lack of activity, and certain heart conditions can damage the inner lining of vessels. Fatty deposits, or plaques, build up and narrow blood flow. Eventually a clot can form or travel and block blood flow to the brain. The stroke may seem sudden, but the process often developed over years. One important warning event is a transient ischemic attack, or TIA, often called a mini-stroke. During a TIA, blood flow to part of the brain is temporarily reduced and symptoms like weakness, numbness, trouble speaking, vision problems, or loss of balance may appear then improve. Because symptoms disappear, people often ignore them. But a TIA can be an opportunity to identify a problem before a more serious stroke. Warning sign 1. Sudden vision loss in one eye. Imagine a dark curtain covering your vision, or everything becomes blurry or gray, then returns. People blame fatigue or screens, but sudden temporary vision loss can happen when blood flow to the eye is briefly interrupted. The retina needs steady blood supply. A small clot can block it and cause amaurosis fugax, temporary loss of vision. This requires medical attention because eye vessels connect to the same circulation as the brain. Warning sign 2. Sudden numbness or weakness on one side. It can affect an arm, hand, face, leg, or an entire side. The key is sudden onset, sitting comfortably and then feeling your face or hand go numb or weak. This is different from an arm falling asleep. Stroke-related numbness happens because a brain area responsible for movement or sensation is not receiving enough blood. Each brain side controls the opposite body side, so symptoms often appear on one side. Take sudden one-sided weakness seriously. Warning sign 3. Sudden loss of balance or coordination. Have you seen someone suddenly walking as if drunk though they haven't been drinking? Sudden difficulty walking straight, spinning sensations, unexplained dizziness, or loss of coordination may indicate reduced blood flow to the cerebellum, which controls balance and precise movement. Dizziness has many causes, but sudden severe dizziness with trouble walking in older adults needs medical evaluation. Warning sign 4. Sudden trouble speaking or understanding. Everyone forgets words sometimes, but stroke-related problems are sudden and dramatic. You may know what you want to say, but the words won't come. Speech becomes slurred or confusing, or you hear language that makes no sense. Broca's area helps produce speech, and Wernicke's area helps understand language. Sudden speech problems, even if brief, should never be ignored. A simple way to remember is FAST. F. Face. Ask the person to smile. Does one side droop? A. Arms. Ask them to raise both arms. Does one drift downward? S. Speech. Ask them to repeat a simple sentence. Is speech unclear? T. Time. If any of these signs appear suddenly, call emergency services immediately. Do not wait to see if it gets better. Script 13. Stroke risk increases after 60 because blood vessels often accumulate damage over time, not because aging alone causes stroke. Major risk factors include high blood pressure, diabetes and high blood sugar, smoking, high cholesterol and plaque buildup, and heart rhythm problems like atrial fibrillation. High blood pressure stresses and damages vessel walls over years. High blood sugar contributes to inflammation and plaque formation. Smoking damages vessel linings, increases inflammation, and makes clotting more likely. Plaques narrow vessels and can become unstable. Atrial fibrillation can allow clots to form in the heart and travel to the brain. The most important message after 60 is this: a stroke is not always random. Many risk factors can be identified and managed. Small daily decisions matter. Control blood pressure, keep blood sugar healthy, stay active, eat a balanced diet, avoid smoking, follow medical advice, and do not ignore sudden warning symptoms. Protecting your arteries protects your ability to move, speak, think, and live independently. If you suddenly experience weakness or numbness on one side, trouble speaking or understanding, sudden vision loss, severe loss of balance, confusion, or other unusual neurological changes, do not wait. Do not tell yourself you'll check tomorrow. Even if symptoms stop, they can be a warning that urgent evaluation is needed. The safest action is to call emergency medical services or seek immediate medical evaluation. Do not drive yourself during a possible stroke. Suddenly losing vision, feeling weakness, or having trouble controlling movements while driving is dangerous for you and others. Call emergency services and wait for transport so you receive care quickly and safely. Time matters.